Welcome to KRQE's New Mexico News Insiders, 2025 Regional Edward R. Murrow Award winner for Best Podcast. Here's Gabrielle Burkhart and Chris McKee. Sponsored by New Mexico PBS.
So we've had conversations on this podcast about one of the biggest issues I think that New Mexico is currently faced with, and that is what happens with people in our state who have mental health issues, not just living on the streets, but plenty of them also interact within the justice system, and just the overall lack of resources in this realm of behavioral health, which is also a term I think we've heard a lot in recent years.
Yeah, today we're getting a chance to explore some of the solutions to this problem, particularly with how a new law that was just passed earlier this year in 2025 will impact behavioral health in New Mexico. What does that look like, and who is tasked with implementing these new reform efforts?
We have two guests joining us this week. Esperanza Lucero is the new Behavioral Health Integration and Reform and Administrator with the Administrative Office of the Courts. Welcome. And the AOC Deputy Director, Sarah Jacobs. Thank you so much for joining us.
Thank you.
Yeah, thank you for having us.
Thank you.
So Esperanza, let's start with you. This is a new role you're taking on in response to the new law that was just passed. This is Senate Bill 3, also known as the Behavioral Health Reform and Investment Act. Before this, you were the director of the Department of Health's Center for Health Protection. You also led the Adult Protective Services Division for the Aging and Long-Term Services Department from 2021 to 24. But how do you see all of those experiences culminating and setting you up for this position today?
Thank you. Great question. I'm very honored to serve in this role with the Administrative Office of the Courts. Yeah, I've about 14 years with state government, learning the roles of the executive side mainly, and understanding how we work with local, county, and city leaders, I think is really important. I've done a lot of work with mobilizing and setting up frameworks for change, and I did that a lot when as serving as the Director for Adult Protective Services. We did a lot with behavioral health services and creating a clinical unit, so that we could really look at how we ensure that the clients were getting the best services that they needed from the caseworkers that are across the serving a very vulnerable population. And so as we were, looking at some of the data, we saw a lot of behavioral health challenges. We're seeing older adults with substance use, with mental illness, and things like that. And a lot of times, Protective Services shies away from serving those populations. And so under my leadership, we were looking at how we can actually get creative with the services that were available. When people need to detox and go into a long-term care facility, those are services that were not necessarily available. And so we were having to be very creative and very innovative in how we approached vulnerable older adults, even utilizing a cane or a wheelchair going into some of these facilities. Those are, incapacities that were not accepted. Those were, services that were not available for individuals. So understanding, the older adult population, getting a good understanding of behavioral health in the state, and then working at Department of Health, really learning the data stewards of the state. So learning all of the different data elements that we have available to us, and understanding, how we change in terms of population health, and we look at behavioral health. There was an Office of Alcohol Misuse and Prevention that I led and oversaw as well during that time, and so that was, a role that looks very much like the behavioral health pieces that we need in place in order to be able to access those resources across the board.
Deputy Director Jacobs, for those who don't know, can you generally tell us what is the Administrative Office of the Courts, or the AOC? What is the administration that this group does? Understand there's a lot of districts, a lot of different courtrooms all around the state. Obviously, the AOC seems like a center point of that. But from your perspective, what does the AOC do?
Yeah, also a great question. So the Administrative Office of the Courts supports the judiciary as a whole. So as a third branch of government, they need administrative support, and that can look like any number of things. It can look like HR, it can look like fiscal and financial services. It also looks like language access services, so interpretation across the state. We run a jury and witness unit, we run pretrial services, we also have general counsel services. So really anything that courts need by way of how do we run this thing, right? How do all these things work together? We have the IT infrastructure at the Administrative Office of the Court, so the statewide case management system for our court clerks and our judges is all run out of AOC. And we also provide a lot of support to the Supreme Court. The Supreme Court and the Chief Justice are really the authority for the entire judiciary. So much like the governor oversees the executive, the Chief Justice and the other justices oversee the entire judiciary. So we provide that administrative support for them also, like how are we making decisions around pay and any number of other things. So, yeah.
I was going to say, I mean, when you think about New Mexico too, and I think sometimes we get blind to it, maybe in Albuquerque and Santa Fe or some of the metro areas, these are cities that have a lot of the infrastructure in place just by nature of how many people live here. But New Mexico is a vast state, and there are some very rural courts that need to function out in that rural part of the state. So that's where I imagine the AOC comes in a lot, is probably doing that support service for many of these courts that, can't hire the person locally to take up that function.
Yeah, absolutely. We have 13 different judicial districts. So like you said, spread all across the state, and many are rural districts, right? And the judiciary and the judges and the staff that serve in those districts are leaders in their community in their own way. And so we work to support them in what makes sense for the community there, right? Not just what makes sense in Santa Fe or Albuquerque.
Okay. When we talk about behavioral health, I want to do some basic defining of what we mean. The recent legislation defines behavioral health services as a, quote, comprehensive array of professional and ancillary services for the treatment, rehabilitation, prevention, and identification of mental illnesses and substance misuse, including telemedicine. But when people hear that term, behavioral health, in layman's terms, what does that mean to them exactly? What should it mean to the average citizen?
So when we talk about behavioral health, we're looking at some different things. So we're looking at people that are experiencing, they're unhoused maybe, and they have mental health issues. So they have maybe a diagnosis or maybe not a diagnosis at this point. They have substance use, so maybe they're illicit drug use that's co-occurring with the mental illness, or alcohol, or other substances that they're dealing with as well. So it's all encompassing of all of the things that I think we see in a lot of the places across the state. And behavioral health affects everyone in the state in some way or another, whether it's directly or indirectly. And so it's one of those topics that we continually hear, and especially with this legislation, we're hearing more and more about behavioral health. I think prior we would always use more mental health kind of terminology, and now I think it's more all-encompassing of the overall behavioral health structure in the state.
So yeah, we I think brought up this topic in part in a recent interview on the podcast that we did. We interviewed Larry Barker alongside a criminal law professor at UNM, Joshua Kastenberg, and essentially that subject matter was about what happens to people who commit crimes. And they're found incompetent by the courts. And the answer right now, as we understand, is that in most cases, essentially those cases are dismissed. There are, some caveats that can occur there, but I think the general thrust of many of these cases is that after an arrest and incompetence is found, oftentimes the cases are dismissed. And then, the people who are at the center of that, often there is no wraparound services to affect any sort of change in their life to address maybe some of the underlying problems that person has, whether that's the offender, and then also, you have the victim's part of it as well. But do you see this new legislation as something that could have a positive change in New Mexico, as something that might change what I just described here in New Mexico?
Absolutely, Chris. I think The legislature this past session was very clear this was an issue that they wanted to tackle. And so there was both some major legislation around competency to address some of those things that you just mentioned. And in conjunction with that, this behavioral health sort of overhaul of service and service delivery. We know, and of course there's a lot of narrative around folks that come into the justice system and cycle back out. And so, I think part of the question is like, well, what is the judiciary doing to address that, right? And the legislature has acknowledged our role in that and has provided us with a good amount of funding to try to create different types of either diversion programs to help divert people out, but also provide that wraparound element you're talking about. And there's several different programs we're working on developing for the court system directly. But this overhaul of the behavioral health system is really the full spectrum of service, and that there was an acknowledgement that maybe this wasn't working the way that we had wanted it to work. And so with the new legislation, we're excited because it's really supposed to be locally driven and what services are missing in those local communities. And then those are the priorities that, we want to fund, I think, as a state. So
We'll be right back with more of the New Mexico News Insiders.
Hi, I'm Logan Rader, host of New Mexico Living. New Mexico News Insiders is sponsored by New Mexico PBS.
If you like New Mexico News Insiders, learn more about New Mexico in Focus, a weekly hour-long show analyzing decisions impacting New Mexico statewide. Stream it anytime, anywhere. Visit nmpbs.org and follow them on all social media platforms.
Now back to New Mexico News Insiders.
Sarah, you're a former prosecutor and previously served as in-house legal counsel for a healthcare company with rehab facilities. You also served as general counsel for Governor Lujan Grisham and deputy cabinet secretary of the Aging and Long-Term Services Department. So I bring this up because I'm curious, from a legal perspective, when you look at this legislation, what do you see as the biggest roadblock to seeing real change in how our state deals with mental health?
Yeah, that's a really good question. I think, there's a couple open questions for me that we'll sort of see over the next several months, kind of how things develop. But I think, honestly, one of the bigger roadblocks is the fact that we are lacking providers, and something that working in healthcare, doing some work on the executive side that intersects with healthcare, you talk with our managed care organizations and things like that, and we're just missing something. We're missing the providers and the folks that are actually willing to do the work. And so to me, looking at building out the sort of higher education pipeline, whatever that looks like, whether that's specialists in behavioral health or whether that's really tapping into our social work population to kind of provide a lot of these community-based services that it seems like, and that, anecdotally, that's what you hear, that those things are missing. So that really feels like one of the major roadblocks.
Yeah, providers there. And, making sure people have access to treatment and long-term care for things like substance abuse or mental health disorders. When they say folks live on the street, it is a difficult thing to balance someone's civil rights and maybe the voluntary treatment that one could argue they may not be in the right state of mind to even enter into, to choose what's best for themselves. Does any of this new effort to address mental health address that issue? Will judges have more options to maybe order somebody to force them into treatment, even if that person says, you know what, it's not for me?
That's also a great question. I think the legislature did a good job of trying to balance these two things, right? People's individual liberty and their ability to make decisions for themselves, and just going full blown into court order, right? Judge is going to order you to do this. Not the Senate Bill 3 behavioral health legislation, but the competency bill that they passed, I think, gets at a lot of that. And what it allows for that it didn't before is to have these evaluators. So if competency is raised in a criminal case, whether it's a misdemeanor or felony case, the evaluations are going to have to be much more robust. And they will look at alternative options as a part of that evaluation process versus just a simple, this person is not competent or this person is competent. So they'll provide in the evaluations, assisted outpatient treatment may be an option for this person if they're willing to, right? Or some other community-based programming. So I think this legislation does give judges an additional tool in their toolbox to help.
Well, it might give them more options, though. Like you said, the existing outpatient facilities might not just exist yet.
Absolutely. Yeah.
Okay.
Yep.
Which is a challenge. We know that the solutions to this issue are complex, not a quick fix. I was reading over SB3, and we can link to it in our show notes if anyone listening wants to actually read through that new legislation we're talking about. But the parameters that it lays out over a series of years, right? It seems like some of the planning and implementation isn't even required to be completed for a while. So I want to start with Esperanza, your first step. What is your first goal within this new role?
Great question. So as part of the legislation, sequential intercept mapping is identified. And that is a big piece. Our behavioral health at the Administrative Office of the Courts has been doing SIM mapping in different counties. Different counties across the state have done SIM mapping. And this is really in line with the Miami model. And people continue to use the Miami model as a reference because they saw some tremendous results, positive results with, doing the sequential intercept mapping and understanding where gaps in services are, where people might be hung up throughout the intercept process on the judicial side. And that way people can actually get linked to services, exactly where they need to be. And it really identifies those gaps in services. So as we start looking at some of these things, really looking at what's already created in those communities, we don't want to reinvent the wheel. We don't want to, our job as the AOC is to listen, is to convene and set up the framework for behavioral health reform. So really taking a step back and understanding what needs are identified in the community, what stakeholders want to actually work on, and start assembling the planning around that. So as we move forward, it's really about convening stakeholders, listening, and getting that input so that we really understand what direction we need to take. One of the first steps that we're going to be looking at is identifying and creating the regional plans and what those regions need to look like. So, we're looking at what the judicial districts are laid out, how the local collaboratives are laid out, and a few other ways of structuring the region so that we can provide that recommendation to the executive committee in the upcoming meeting. And so as we move forward, that's probably one of our first steps because the funding will be structured in that same way, the regional planning will be structured in that way as well, and the SIM mapping will also be structured. So everything from there will sort of be dependent on that structure. And so I would say the first step is really understanding how people want to be coordinated and how they want to be regionalized in these planning processes.
So these sequential intercept mapping sort of workshop meetings, this process, I guess I should say, some of that includes, as you mentioned, gathering all the stakeholders together, community meetings taking place all over New Mexico over the course of, I take it, probably the next year here at least. If you can just tell us a little bit more about, how will people know about when these workshops are happening? I imagine there's going to be some sort of getting the word out, so to speak. And what is the end goal? What are you looking for to say, okay, we've done the due diligence here?
Absolutely. So I think a couple things. Our website is going to be a good place for people to understand what mapping and planning are going to be scheduled. We have some upcoming planning sessions in Los Alamos County and one in Las Vegas as well that's coming up. And so we're going to continue to advertise and, look at how we get the health councils involved, how we get some of the local collaboratives involved so that they can ensure that the appropriate stakeholders are at the table as well. And so as we move forward, I think the end goal is really to ensure that we map the entire state, that we can identify regional plans that can get approved and up to the executive committee so that funding can be leveraged and released, because that's really the way the design of the legislation is the regional plans will go to the executive committee, and the executive committee will approve, maybe modify, ask for some revisions, and then they'll have the final say in terms of what priorities, up to the 5 priorities that region wants to work on, and that'll leverage that funding so that it can actually go out to the communities and provide the services that it needs to.
And I mentioned a timeline of over the next year, but just to ask you, what is the timeline here?
It's a moving target at this point. I really feel like we can get a lot of stuff done. There's a lot of passionate people in the state around behavioral health. And so, the emails are coming in. They want to help. They want to support. And I think we have a lot of, people behind this effort and this endeavor so that it can be successful. So I would say that, I think we can certainly make some very big strides within a year. And, at a later date, I think we'll be able to share more of the solidified timeline as we flesh more details out.
Who attends the workshops?
So it's many different people. So we have, the courts, we have law enforcement, we have stakeholders, we have providers, we have people with lived experiences, and we have family members, right? So we have a lot of people that are dealing with different aspects of behavioral health from different vantage points. And so we want to hear everyone's perspective so that we can really make those informed decisions around what priorities make sense for this community and how can we actually leverage the workforce, as Sarah mentioned, and some of the other pieces that, we do have to lay out in order for this to be fully successful.
One of the issues or the gaps in the system, it seems, like you mentioned, Sarah, is definitely providers. That's something I think everybody agrees with. This was brought up again in our last conversation with Larry and the criminal law professor, but almost every conversation that we've had about this issue, when you talk about mental health, is that a lot of these extra resources just don't exist yet in our state. And we've also heard some listener feedback after our last episode about this, asking to hear more from the medical experts. But how do you see these new reform efforts, or do you even see them as addressing that, helping to bring in providers into New Mexico? I heard you reference maybe we need to create an educational pipeline, but that doesn't really speak to this legislation. So are there new things happening to bring in providers into the state?
Well, the judiciary can't speak directly to maybe how the state is trying to recruit providers. I know the governor has made a big effort to try to get medical professionals to the state, has different sort of recruitment efforts going on that executive side. But I think there's a lot of opportunity here, given the amount of money that the legislature's invested in behavioral health. And the providers that we do have here are also at the table for this and have been reaching out actively, wanting to know how they can be involved in terms of providing additional service outside of what they already do. So I think there is opportunity there. I think time will tell kind of how that ends up working. But I do think people see the need, the funding is available. So what kind of things can we do to support our existing providers and getting more folks on board and or encouraging others? And I think that may be a part of some of the regional planning that'll get fleshed out.
We mentioned the money aspect. Can you just establish how much money is the state investing into behavioral health?
So the state put about $100 million into the newly created Behavioral Health Trust Fund in the session. It's my understanding they intend to continue to put into that fund. There's a lot of money that was doled out to a bunch of different places. It's close to about the same amount for expenditures over the next several years. And how we sort of received an explanation was that we want you to spend this money, then you come back and we pull from the trust fund. So, the funding is limited for the next few years, but it's a lot of money. And we expect that it will continue. And that was the legislature's intent, so.
We'll be right back with more on New Mexico News Insiders.
Hi, I'm Monica Wicki, host of New Mexico Living. This episode of New Mexico News Insiders is sponsored by New Mexico PBS. If you enjoy New Mexico News Insiders, check out New Mexico in Focus, a great source for insights about what's happening in our state. Catch their podcast and videos at nmpbs.org or stream it anytime, anywhere on the free PBS app. Now, let's continue to New Mexico News Insiders.
We talked a little bit about the stakeholders participating in the SIM process of this. I'm thinking about sort of after that wraps up. Can you tell us a little bit more broadly about who the other stakeholders will be? Or are you going to keep participating with them along the way? So sort of who will continue to have a seat at the table when it comes to implementing some of these reforms?
Sure. Great question. I think the same stakeholders are probably going to be interested in seeing this through and want to be a part of the regional planning efforts and sort of identifying what priorities go into that plan, reviewing those local level planning as they go through different iterations up to the executive committee. So I think that was sort of the difference with the way that the SIM mapping has been done historically in the state to where it's at now. We would map and we would identify those gaps, and then, we would be able to create action plans from there. But with this new legislation, it kind of takes that action planning a little bit further because there is so much money attached to it that it can actually be driving results, and it can actually be pulling down large amounts of funding for those efforts. So it's not just about talk anymore, it's actually about action. And I think that's what's really profound about the legislation is that we're putting a lot of investment into this this subject that everyone continues to talk about over the years, but it's actually it's not necessarily talk anymore. We're going to get into the action steps, we're going to get into outcomes, and we're going to really be able to change the health and well-being of individuals across the state. And so having that extra amount of money, I think, really takes this a step further in the planning process.
In reading through the legislation, there's a behavioral health executive committee that's required to meet at least quarterly. They're required to make reports to the Legislative Finance Committee. The AOC will be coordinating regional meetings and such. But reading through it, like all those reporting requirements, I'm curious, how do these report card requirements, workshops, meetings translate to real change that people will start to notice maybe on the streets or in the public? Because we've heard complaints about, the slow wheels of government generating reports, the cynicism around that, I guess. How does that necessarily get to fixing the root of the problem, if either of you can address that?
I think a few things about that. I think this executive committee is made up of folks from different branches of government, which has never been the case before in terms of a service delivery mechanism, right? So this is a very new role for the judiciary. But that being said, I think it offers a lot of opportunity for some checks and balances in a way that we haven't seen before. I think the reporting, we're going to meet the reporting requirements, right? And that is not something that I think is going to slow anything down. I think it's just part of what we're going to have to do to kind of meet our requirements. But this executive committee already has their first meeting scheduled, where they will receive sort of a recommendation for the regions. And so we've set out kind of an initial timeline to make sure we've hit the things we need to in the statute, but that we also are sort of pushing on the other branch of government to get their things done, right? Like we both have stakes in this fight, and we heard, not fight, but we both have a stake in this, in making sure that this is successful. And so I think we'll both be looking to each other, sort of pushing, where are we with this, right? Because we both are going to have to answer to the legislature in terms of how this is going to be successful. So I think over the next, I don't think people can expect to see something immediately, but they are seeing the fact that we are doing a massive amount of outreach, that we want to hear what they want to see and how they want to see this happen at the local level. I think once those regional plans are approved by this committee is when we're really going to start to see some things change for people on the ground.
How will you measure success? What sort of metrics are you going to be looking at to see whether you're successful?
So there's some evaluation criteria that's going to be established between the Legislative Finance Committee and the Healthcare Authority. And so as part of the regional plan, there does need to be performance measures and things like that. And they did a good job of actually adding best practices and promising practices. So everything that goes into the regional planning has to be one of those two items. So these can be pie in the sky things, but these are also things that that have already been tested and evaluated to some degree as being successful. So the initiatives and the priorities that are going to be outlined are going to be in line with that. So we're not, picking things and just going to start doing things, in a way that we think makes sense. We're going to be actually picking behavioral health priorities around best practices, promising practices, so that we're already ahead of the curve when we want to start looking at these initiatives and seeing how effective they might be for our population as well.
Well, thank you both for being here. Is there anything else that we didn't ask you directly about that you wanted to add to make sure folks or listeners, viewers understood a little bit better about this?
Thanks for that opportunity. One, thank you for having us on. I think what I would say to the listeners is, please reach out, whether that's to your local government leaders, whether that's to your local judge, whomever you know. We want to hear from you about how you see this working in your community. And also, I know Esperanza and I were both a little nervous to come on this award-winning podcast.
Thank you.
And it's just an honor to be here with you all. Thank you so much for having us.
Appreciate it. Thank
Yeah,
you.
for sure.
And I'll kind of echo what Sarah mentioned. Thank you for the opportunity to speak about this incredible legislation. And, if we can come at a further date to provide more details as we solidify timelines and provide a little bit more of where we kind of sit, I would welcome that as well.
Yeah. Well, certainly a complex issue, and I wish you both well in your endeavors. Thank you so much for joining us.
Thank you.
Thanks again to Esperanza Lucero and Sarah Jacobs for taking the time to tell us about how the new legislation will translate into actual reform efforts around New Mexico. It'll be interesting to track their progress.
Yeah, and I was thinking about just the work that they're doing. It is going to be a really, I think, heavy lift, but hopefully something that will have very impactful results toward an issue that we know many people are concerned about here in this community. So
yeah, she said, think about it like laying the foundation of something, and it's a big lift.
Not easy work for sure. We appreciate you listening, watching. If you have an idea yourself and you want to see us flesh it out here on the podcast, let us know. I'm at chris.mckee@krqe.com, also at Chris McKee TV.
And I'm Gabrielle.Burkhart at krqe.com via email and gburknm on social media. Thank you all for listening and watching.